Like many councils across the organization, the Clinical Practice Council has been busy the last couple of months identifying the organization's needs related to the COVID-19 pandemic. We are excited to share updates from our last several meetings and share future plans. Before diving into updates, I wanted to start off by sharing more about who we are. The Clinical Practice Council is an interdisciplinary team of nurses, respiratory therapists, pharmacists, lab, social work, child life, and nutrition who identify and problem solve practice issues and implement best practices that cross communities. One standing agenda item is value analysis. New product requests and potential substitutions are brought to the Clinical Practice Council to review. When the COVID pandemic hit, department leaders were asked to identify key product items, track inventory, conserve inventory, and consider alternatives. They worked on identifying key product items and brought forward a request to the Clinical Practice Council to create a plan for supply conservation. The result was the creation of the Supply Conservation Tips document. The Supply Conservation Tips document was posted on the COVID page in March and continues to be updated as needed. Find it by clicking on the COVID page link, then either clicking on the supplies link or scrolling down to the document. Parts of the document are shown here. These topics were initially discussed in March and have been revisited frequently since. Some recommendations brought forward by this team include using supplies until they no longer can serve their purpose and/or become contaminated, limiting bulk items and items brought into the room to only the needed quantity, opening supplies when needed and not in anticipation of needing it, PPE conservation methods including limiting room entry to essential personnel, posting RN and RT phone numbers on whiteboards for families to call, utilizing the family phone to call into the room prior to going in to help gather appropriate supplies the first time. This limits the amount of trips in and out of the room. The document is updated as needed, taking into consideration the ever-changing availability, recommendations, and need. For example, earlier this spring, more clarity was provided for feeding supplies, and June's update recommends returning to single patient use for Z-flows based on supply chain reports of no expected shortage. Last, we addressed future considerations sparked by reports in the literature, conversations on listservs, etc., not yet felt at Children's. Examples include frequency of routine dressing, tube, and line changes, hang time for IV fluids, filtering lipids, and PPE conservation in context of dual signature process. Recently, we started to look at hang time for IV fluids, not due to a supply issue with IV tubing, but with drug supplies. There is a subgroup working on this and expect more to come later this summer. Please routinely check the COVID page for updates on how you can impact supplies. The date of the last update is posted on the COVID page and on the top and bottom of the document. Please contact your CNS or CPS or unit leader for those areas without a CNS with any ideas or concerns. Thank you.